The coronavirus pandemic has been slow to reach Africa, but the number of cases is increasing fast as some governments ramp up testing. What is also happening are efforts, homebred efforts that would be to tackle the pandemic when it hits. Like at this factory in Ghana, where workers are racing to reach a government target of 3 million domestically produced face masks by the end of April.
These masks, I'm wearing one of them, give the protection that global standards demand. And we're going beyond that. We're going to be producing another set, which we call the medicals, for those on the front line, dealing with those who are really ill.
I spoke to Edem Adzogenu. He is the co-chair of the AfroChampions Initiative. The project is helping the African Union mobilize resources to tackle COVID-19. He started by telling me what lessons Africa learned from the 2014 Ebola outbreak.
The Ebola epidemic allowed us to learn two things. One, the need for our interdependence on each other as a continent, to be able to mobilize our collective responsibility towards each other by absorbing our collective strengths. You would recall that even though it was just in Liberia, Guinea, and Sierra Leone, countries in Africa initially started locking their borders, stopping flights from people coming from the endemic region into other parts of Africa. The cases didn't spread that much in Africa, but it went to Europe, it went to America, and it alarmed the entire world. People were concerned about Africans stopping flights, and they needed those corridors to be open for goods to move in. But Africa, ECOWAS at the time came together and in support with the African Union, mobilized the African private sector to team up with them. And you recall there were a lot of African multinational that have businesses in Liberia, Guinea, and Sierra Leone who had to shut down. We learned that this was something that the African governments couldn't do alone. So private sector came together, mobilized resources, sent doctors, volunteer doctors from from other parts of the continent to go to Liberia, Guinea, and Sierra Leone. And as a consequence, we saw that we were able to, with the support of the international partners, eradicate Ebola. So that collective responsibility was important. It also helped the continent change the way it looked at things as far as immigration and movement of people. We still had a number of countries that still, especially the hub countries that had a lot of traffic, that still kept checking temperatures for people who were coming into the country, that had sanitizers at the airport for people to clean their hands and things like that. And it changed the way we saw hygiene practices, particularly in airports where we had huge traffics of people coming through. But the biggest lesson for us was the public-private partnership that came as a result of this. And that's what inspired, the creation of AfroChampions, which I currently co-chair.
Right. So, as I mentioned in the beginning of this conversation, you've been tasked with assisting the African Union in mobilizing resources to tackle COVID-19. What exactly are you doing?
So first was to reach back to the private sector networks that were pretty much involved in the Ebola epidemic, to say, here we are again. We have another epidemic at hand. We were also pretty instrumental in pushing in supporting the heads of states in their wisdom to set up an African CDC, because we thought that it was important to have an African Center for Disease and Control that can sort of coordinate the continental efforts that is necessary to fighting epidemics of this nature when they do come. So our main responsibility is to provide mobilize resources first, financial resources, to support the African Union Fund that has been set up to mobilize support to buy to do the bulk procurements that the continent needs, because it's difficult for countries on their own in these days where different people are procuring face masks, PPEs, protective equipment, ventilators, and all of the things that we need, test kits. So getting those resources to a consolidated fund that will be able to procure those resources on behalf of the continent, but also getting the personnel necessary, the volunteer support, because you could have all this equipment and not have the personnel to use them. So getting the doctors, the paramedics, the nurses, and all of these human resources that CDC needs to deploy into areas of need.
It's been said that Africa is at the foot of the mountain, and perhaps correct me if I'm wrong in terms of what stage we're at in this pandemic. But what is your prognosis, so to say? What should Africans be bracing for? We've seen what this virus has done in countries like Italy. We've seen what it's done and is doing in the United States, what is the inevitable for the continent?
I want to be optimistic and say that, yes, Africa caught this at the tail end, and the numbers we've generated so far since the lockdowns that have been done in a number of countries are not enough to suggest. We've done probably about 300,000 tests so far in the entire continent. But we looked at the data that we've generated so far. It's still too little to be able to predict what will happen. Even in the advanced countries where they collected a lot of data, even some of their projections in terms of their modeling as it relates to things like the number of deaths that you see. When they thought they were going to have more deaths, they didn't quite have those deaths. And when they didn't expect, they had a lot more deaths, like you saw in Italy and other places. But then you see Portugal and other places that really didn't register the kind of deaths. So one of the things that I think the continent has done is we've been able to shut our borders very quickly. We didn't get the mass transportation of people into the continent with the virus like other people. And even if we did, the past 2 months, we haven't seen people falling down dying. We haven't seen our hospitals flooding. And most of the data we've collected so far shows that a significant number of people, even who are even positive, are asymptomatic. And it's not really gone into the vulnerable population. So if you ask what should we be bracing for, it's the unknown. We don't know. What we should do is we should get more and more people tested as much as possible. And which is why AfroChampions supports and has partnered the African Union, CDC again, in this pact, partnership towards getting people tracked, traced, and tested, to be able to get at least 1 million people tested within the next 4 weeks, 10 million people tested within the next 6 weeks, and create get the numbers that will help us understand what we're dealing with. So I don't really think that we're in a situation where we're going to, that's my personal view, that we're going to be seeing millions of people. But that's not to say that we should let our guards off. We should continue to maintain all the standards of hygiene, the protocols under which, we can prevent the disease, because we cannot afford to have our hospitals flooded. We'll not be able to have the personnel, the doctors, the number of ICUs to be able to deal with this pandemic. And as much as possible, focus on the primary healthcare needs, get people identified, tracked, traced, tested, and then isolated for treatment.